Hello, you are watching News 9 Digital's Facebook Live with me, Amrita, and today we will be discussing about the many coronavirus mutations and how exactly it has been a concern for vaccine developers. So in a latest study, there is something new that has been revealed about coronavirus mutations. Now the world, as we know, is awaiting a COVID-19 vaccine quite imminently. And amidst this development, the greatest fear of the scientific community is all about the black spots and what is unknown about coronavirus mutations and the coronavirus itself. And more importantly, scientists are also worried about how the virus is mutating, which might become a hindrance to vaccine development process. So one, either the virus is mutating to adapt to human immune system, or it is mutating to become a little bit more weaker. So we spoke to earlier a lot of epidemiologists and experts, and their opinion was that so far the virus is mutating as a less dangerous virus, and it is following the mutations of other flu viruses as well. But since novel coronavirus has also defied several other previous rules or previous ways of how other flu viruses mutated or how they progressed, how they came in waves, it is unknown how in the future the novel coronavirus will also act. But now a latest research, which also included researchers from the Walter Reed Army Institute of Research in the United States, who assessed the genome sequences of novel coronavirus from more than 27,000 individuals with COVID-19. And they found out specifically over here is that the virus has mutated minimally since the beginning of the outbreak in China all the way back in December 2019. And based on the study, they also said that so far SARS-CoV-2 genome has evolved through mostly random process rather than through adaptation to the human hosts that it encounters. So meaning to say that it is becoming weaker by the day. Now the researchers also pointed out that earlier there was a domination of a mutant form of the virus in several parts of the world, in which a molecule aspartic acid denoted as D in the viral spike protein, which it uses to enter the host cells, is replaced by another molecule, glycine, which is G. As said by other studies, it also made a mention of this, and the scientists behind this current study said that the D614G mutation cannot be seen as evidence that the virus is adapting to humans. They said that they have not been able to find any link that this mutation is specific adaptive forces. So viral diversity has challenged vaccine development efforts for other viruses as well, such as the HIV or influenza and dengue, but global samples have shown that the SARS-CoV-2, which causes COVID-19, is less diverse than these viruses. So how exactly is viral diversity a play in vaccine development process, and how is it affected? That is what is the most important question right now, and I'm also being joined by Dr. Paramesh, who is a pediatric pulmonologist and who is also involved in the core committee during the H1N1 outbreak right here in Karnataka as well. So let's go to Dr. Paramesh. Dr. Paramesh, thank you for speaking to us first of all.
Thank you, Amrita.
Dr. Paramesh, my first question to you is, how does the viral diversity play a role in the vaccine development process, and how are mutations a hindrance to vaccine development?
Yes, as a matter of fact, every virus, they want to live, just like any life.
Yes.
They want to propagate their progeny completely. So they have to adapt to the situation. That is nature's way, as a matter of fact. If is a genetic pattern, what happens, shifting happened once in 10 years like that. We had a shifting like a pandemic because of that. And also drifting happens quite often, where about 5 to 7 varieties are there, as a matter of fact. They are not much, as a matter of fact, to worry about it. Strongest one which produces more disease, based on that one, we have to produce the vaccine on that one.
All right.
As a matter of fact. And this vaccine, now the third stage is going around in India. And I think probably if the vaccine comes there, it takes another 6 months, as a matter of fact. Thousands of members have to be studied, 15 days, 1 month, 3 months, 6 months, to identify how effective the vaccine is, how long it lasts, how many injections is due, and also is there any early reactions or late reactions. And also when the vaccine comes, preparing for all the population may not be possible. We have to aim to give this vaccine to the people who are at high risk. The hospital, intensive care ayas, ward boys, and laboratory technicians, nurses, doctors, then the administrative staff, then the high-risk population.
Yes.
I think in this context, we have to distribute the vaccine for all the things. The cost is the most containment factor, as a matter of fact. WHO has a thing, when the vaccine comes, and it probably next 6 months it might be able to come, at least 20% of the population has to be covered. They all come in the high-risk group and all these things. And people can never, we are proud to have, we are good companies who are producing a lot of vaccine in India, unlike other countries. Poor countries is very difficult to manage how to acquire this one. If the people have to buy it, or government has to buy it, is there very difficult. Somebody has to help them.
Yes.
I think so. I don't think small drifting, we have to worry about major components they have taken making the vaccine. Let us think positive way. Let's get going. Yes, certain changes going to happen every year. This vaccine has to be changed, as a matter of fact, like any other virus.
Okay.
Any other virus, every year it has to come there. This thing, one of the respiratory viruses, just like other respiratory viruses, I think every year we might have to prepare a new vaccine for this, depending on the predominant genetic drifting has happened based on that.
True. Also, Dr. Paramesh, if say the vaccine which is approved for use is a foreign vaccine or developed through foreign clinical trials, so will it work here in India for the Indian population?
Yes, if it is the same genetic pattern, it works, because this is a specific. This is acquired immunity, adaptive immunity for the specific virus. If they have the same thing, it will protect.
Okay.
Yes.
All right. So one vaccine can beat all the other coronavirus mutations or any other form of, the SARS coronavirus 2 in any other part of the world.
Yes, it will work. For if it is specifically same genetic pattern vaccine, it definitely helps all over the world.
Okay. Okay. All right. Thank you so much. Thank you so much, Dr. Paramesh, for speaking to us and giving us your insights. So we heard the experts speak about what are the due process that is followed when a vaccine for a disease is being developed, how it is distributed, and in case if it is a foreign made vaccine, whether it will work in other countries, on other populations as well. So those were some of the answers, and this particular research which said that the coronavirus mutation may be getting, the coronavirus might be getting weaker through mutation. They've also said that more research needs to be done in this manner. So more research and continued efforts in the vaccine development process will give us the future answers. Till then, you can leave your opinion in the comment section down below of what you think of the coronavirus mutations as well as the vaccine development process. Also, like, share and subscribe to News 9 Digital.